Mr. Doggett.
Thank you, Mr. Chairman. Both our healthcare professionals and their patients deserve the long-term peace of mind that a permanent replacement of the broken sustainable growth rate policy would bring as approved by the committee today, not the uncertainty of another stopgap three-month extension that the House as a whole will approve today. And while I'm pleased that some progress is being made in developing actual legislative language to implement genuine reform, the changes in this system are not free. Nowhere in today's action is there any suggestion of how to pay for more than $100 billion of cost to fix this system. Indeed, there has not even been bipartisan discussion of payment. Instead of figuring out how to pay for the first $100 billion, last-minute changes that our Republican colleagues have made in the last few hours have added about another $8 billion of unpaid costs to the bill. Like funding for our broken national transportation system, we can usually achieve bipartisan agreement about the need to spend money in this Congress. It's just when you try to figure out how to pay for it that bipartisanship breaks down, as it has totally broken down on funding our transportation infrastructure. I am absolutely in favor of a permanent fix, but not if it is financed by borrowing more money from the Chinese, or by undermining the Affordable Care Act, or by imposing significant new cost on our seniors and disabled. It is not by accident that the public could be confused by what is happening in Washington today. On the floor of the House, an emergency stopgap measure for the next 3 months, much like the emergency stopgap measures that have been approved one year after another, is being adopted. In the House and Senate committees, a permanent answer without financing is being adopted. The approval of one does not necessarily mean that the other will be approved. Without a clear mechanism to fund this measure, it is not at all clear whether today's action represents more than a symbolic victory. I yield back.